evening. Welcome to your 90s TV channel Healthy Life. Tonight, we have with us two very special guests, Dr. Oğuzhan Koşar from Derindere Hospital Health Tourism Director and Dr. Mustafa Kavu Durmaz. Welcome.
Thank you.
How are you?
Thanks.
Fine, and you?
Yeah, I'm perfect, thank you. I would like to welcome you and thank you for accepting and being here.
It's a great honor for me to be here to inform
It's a
people.
pleasure
For us
for
too.
me also.
For us too, thank you for coming. I would like to start, first of all, with Dr. Oğuzhan by asking me a very important question right now that actually interests all of us. We know that health tourism has risen up really hugely in the past years. I want you to explain us the situation currently with health tourism.
It's a very general question, actually. We are in an era of post-COVID duration, you know, and just a couple of months ago, everything was in its routine, and everyone was coming and going, and everyone was trying to be to get much more health when compared with this era. But after COVID, I mean, 11th of March, you know, maybe remember that. That was a very, after the 11th of March, we just had entered a new era.
Yes,
And after COVID arrived, everything just changed. It was a pandemic, you know, and it just started from China, spread throughout the world, and every single country had been affected by this virus. And after that, we have been affected as well. For a couple of months, all the things had just stopped and halted, especially the planes and comings and goings. All the things had to stop. And after that, we entered in a new plan, in a different schedule, and somehow the spread of the virus decreased a little bit, and after that, people just started to demand the healthcare tourism once more again. And this was a different way we think.
It affected positively, right?
It affected us positively, just because all the things had to be stopped somehow, and people had to stop their demands about healthcare. And for example, if you just want to get a nail surgery, you just have to stop it for a couple of months, and its end point is unclear. Really, it was a duration where people really don't know when it will end, and that had affected as as I told you. After that, all the patients collected together, and soon after opening season, once more after COVID, all the people just made a small attack to our medical service. After people had to stop their medical needs from abroad, just not in other countries, and Turkey as well. All of the surgeries had to stop, you know, and after that, a couple of months later, after the spread has decreased, all things reopened, and our healthcare tourism system has started again once more too.
So how did coronavirus affect the nose surgery department?
Well, the coronavirus affected every department, and it has been affecting also the otolaryngology, which is I like to introduce myself at first. I'm an otolaryngologist, ear, nose, throat surgeon, and we have been in this pandemic on the front line, just in front of everybody, every healthcare providers. We have been on the front line most of the times we are interfering with cold patients normally, and in this pandemic era, pandemic time, we have been treating cold patients and common cold, and also the COVID signs, COVID symptoms mimic the cold.
It does.
Yeah.
It's a hard
And
job for you.
and it is a dilemma so many times, if it's a common cold or it's a for me at least, I am having trouble with diagnosing the common cold or a COVID. So we are very obsessive about every little signs of patients. We are treating, we are having doubts about sore throats, very mild fever, coughing, and dyspnea, breathing
The
problems.
same diagnosis of
Yeah,
coronavirus.
the same. Yeah, we have we have doubts, and we are performing X-ray scans and CT scans, X-ray radiographs of the chest, and we are performing blood tests, and the laboratory tests and the screening, and
So you're trying to fully understand if the patient has COVID-19 or not.
yeah, we are very obsessive. We are more obsessive than normal times, and we have also been very careful not to have direct contact with our patients. We are using gloves, surgical gloves, most of the time, every time. Masks. We are wearing protectors for the eyes, and when we are talking to the patients, we need to. I'm talking for myself. I am trying to keep the social distance even with my patients, which is not very possible most of the time by the.
As you said, you are in the front lines.
Yeah, I am in the front line, and also I need to, as an otolaryngologist, I need to examine the nasal cavity most of the time, examine the nasopharynx, which is behind the nose, and the nasopharynx and the nasal cavity are the places where the samples are collected for the COVID patients. So just I'm seeing myself as I'm collecting, like I'm collecting samples. I am carrying the risk of the healthcare provider, which is collecting every patient's samples. So I have a very big risk.
So you're face to face with the possible virus.
Face to face with danger, and I think I'm used to that. I think I learned how to manage that.
Yes, but I think Turkish doctors have always been really brave in this particular subject. From other doctors, it differs them from European or from Balkanic doctors. Turkish doctors have always been in the front lines when it comes to like any sickness. They've always tried to as close as possible with their patients, and I think that's a very positive thing.
Yeah, well, I think the Turkish health system is very easy for a patient. The Turkish health system provides just immediate intervention to the doctor when a patient has a very little sign. He can go to the specialist doctor, he can go to the house doctor, and he can just see the doctor whenever or which hospital he wants. So as doctors, as healthcare providers, we are seeing more every day than foreigner doctors, than the other nationality doctors. For example, in government hospitals, an average otolaryngologist is seeing about, in Istanbul, like 90, 60, 98, 100 patients a day.
Per day?
Yeah, per day.
A single doctor?
Yeah, in government
that's
hospitals.
A huge number.
That's a huge number. And I don't know if European countries have numbers like that. So we, as Turkish doctors, are used to work with a load of work. We are used to doing so much job, so much work. So we are used to that.
So you're already prepared for coronavirus?
Yeah, yeah, we are already prepared for coronavirus,
Okay.
I think.
Okay.
But it is it is not something, it is not just work, but this work includes the management of the risk. That is very important. So you can work, just working is not only enough. You have to protect yourself also.
Yes,
So if you don't protect yourself, you cannot work, and that's a problem also. So we are, I think, successful in doing that job also.
So, Dr. Oğuzhan, as you know, health tourism is a very important subject, but is Turkey actually getting what it deserves? Because we know that Turkey gives a lot of advantage to foreign patients that come from abroad. Is Turkey actually getting what it deserves?
Actually, no. I should honestly, to be honest, I do believe that Turkey has not taken its share, because when compared with the rest of the world, if we are talking about the total quality of the medical help to the patients, we are serving utmost quality to the patients with an affordable prices. With affordable prices, we are serving, as I thought. And these two parts, when combined together, makes Turkey much more, makes Turkey, brings Turkey in a place where Turkey should get much higher shares from the total amount, total part of the healthcare sector, health tourism sector, and it should be somehow increased. And we do deserve this, and that's the that's a very as I thought, there are two different parts in healthcare sector, and one of them is the quality, and the other is the price.
So these are the two advantages that Turkey actually gives to foreign patients. Yes, okay.
We serve both of them with affordable prices. We serve very utmost level, high quality medical assistance and medical aid to the patients. And I do believe that this share should be increased somehow as the time goes by, not just because Turkey deserves it. The people deserve that. I mean, people deserve the highest quality with the affordable price. If we are talking about the price, Turkey, especially in our country, in this city, specifically, if we are talking about the hospital where I'm working at right now, Hospital Derindere, I mean, we are serving, we are not claiming that we are serving the cheapest prices. We are not the cheapest ones, but we are serving the utmost quality, highest technology-backed medical assistance, medical help to the patients, medical assistance, medical help to the people with the affordable prices they can reach to. I mean, that's the crucial part. And if we combine all these two entities together, and Turkey should be the best place for choosing medical help by the patients all around the world. That must be the thing, that, in my opinion.
So I think Turkey has another advantage on medical health tourism, because Istanbul is in the middle of the two worlds, the Europe and Asia. It has a very, very, very important geopolitical state, and it has a very nice culture, very, very nice, interesting culture for a European tourist. I mean, he can have a secure operation. He can have affordable prices. He can and he can feel. He can
feel at home.
Yeah, he can feel at home. He can have a reliable service of health, and he can see the site.
Yes,
that's the most funny part, I guess.
Actually, I wanted to talk a bit more about the advantages of techniques that are used in Turkey in according to health?
Advantage, what do you mean? The techniques?
Well, I mean, if a patient comes from abroad, of course, that there is the pricing and there is the health treatment, but is there something different that Turkey offers to patients?
Operational techniques, you mean?
Yes, yes.
Yeah. Well, in my field, I can answer that. We are doing mostly nose operations for as a medical tourism field. In medical tourism field, I am performing nose jobs mostly, and nose jobs have very different techniques right now in compared to 10 or 15 years ago. So many new techniques have been are being used right now, and I'm trying to update my practice according to those innovations. And I'm following the new techniques. I can tell you.
Yeah, in what occasion should a nose procedure be done?
Well, a nose job is
basically a nose job.
Yeah, nose job, nose operation, rhinoplasty. You can call all of that. When a patient needs nose job, is mostly we have breathing problems. If someone cannot breathe properly through the nose, he should see he or she, the individual should see a nose doctor, an otolaryngologist or a plastic surgeon, doesn't matter. Well, the breathing problems may be caused by congenital, like you can have it when you're born, or you can have it after. It can be caused in developmental stages. You can have it after you're born also. The problems are structural, developmental, or traumatic. You can have a trauma, you can have an accident, or some people have different types of trauma to the nose, and the shape of the nose and the airway in the nose can be interrupted. That's what we see when we examine the nose, when we examine the nasal airway, and we decide if there is a need for operation or not. When we see the patients, we are examining through the nose with endoscopes and with direct light, direct seeing, and the most common problem we see is nasal septal deviations. What is septal deviation? There is a septum in the nose, the middle wall of the nose, which is separating the right nose and the left nose. This wall, I mean, is made of cartilage on the front and the bone in the backwards, and this is mostly deviated to one side, right side or the left side.
I think a lot of people have actually that problem.
Yeah, most of the people, 1 in 9 or 8 in 10 people have those kind of problems, but everybody doesn't need surgery. The ones who need surgery are the ones who have breathing problems. And when you have breathing problems, you are aware of breathing. Normally, you shouldn't be aware of breathing. Yeah, you shouldn't be aware of a problem. You shouldn't be just aware of breathing. But if you feel like you cannot breathe, then you have a breathing problem. And the time is also important. You can have a breathing problem during a common cold, and when the common cold is over, the breathing problem is going away. We don't operate those kinds.
But if this problem continues, it has to be operated.
If it's a chronic problem, if it's a chronic disease, we need to operate that. And some other problem one other problem in the nose, we have soft tissue enlargements, like we have nasal turbinates in the nose, which is humidifying and warming the air we breathe, and also we have allergic problems. We can have polyps in the nose, which are masses of soft tissue taking place in the nasal airway, so it's interrupting the nasal airway, so it causes breathing problems. If we see those kinds of problems, we are operating. The most common problems we see when we are interfering with nasal airway issues.
So, Dr. Osan, we just learned about techniques, not especially in this area. I want to ask a more general question. Is Turkey actually adapting to all of these surgical procedures in general? I mean, the health treatment in Turkey, is it adapting to the world? Or is the world adapting to Turkey right now? What is the case in here?
Actually, I can't easily claim that we are at the highest level in surgery. One of the best are located here in Turkey, especially if we are talking about, especially in Istanbul. And our doctors, specialists, are the best of all in their fields, and very experienced. We work with experienced doctors, experienced specialists, especially otolaryngologists and plastic surgeons and general surgeons. All kinds of surgeries can be made, just as the same as it is being done and the remaining part of the developed world. We are serving the best medical quality to the people, all of the people, in affordable prices. That's our difference from the remaining part of the developed world. Maybe I can easily claim that we are better than most of the places located in Western Europe, especially. Maybe I can claim that our medical system is somewhat better than even the UK.
That's a big claim.
Really, because I've been in there, and the remaining part, the France, because reaching out to the medical service out there is quite hot, very hot for the average people, average person. If we are talking about emergency service, for example, you can the waiting time can reach to hours when compared with the Turkey, as my doctor colleague told a while ago. It's so easy to reach to a doctor in Turkey, especially in the emergency section and the remaining specialties, because we worked a lot for years, decades, to reach this kind of medical service. We spent years and spent our nights and days and the daytime, during the nighttime. We served a lot to so many people, many patients. So many doctors, patient numbers exceeds far more beyond than compared with the remaining parts of the Europe. For example, in just 5 or 10 years, a specialist or a GP, especially if it is located in the emergency section, I can claim just because I am in the emergency room. The doctors working in Turkey can become over-experienced just because they see much more patients than compared with the rest of the world. I mean, in just 5 years, we already reached to the numbers of a doctor working in Europe that he or she can reach an entire professional life.
There's much more experience involved in that, yes.
And that provides us the utmost experience, and we become over-experienced in our fields. And when compared with the remaining parts of the world, especially if we are talking about the developed world right now, and I'm not comparing Turkey with the third world right now.
Okay.
I'm not comparing Turkey with the countries around Turkey right now, especially Balkans or northern parts or the southern parts, the Mid-East. Just name it. Just think about the rest of the parts, the countries that will surround us right now. Turkey is incomparable with them. We are at the level that can be only compared with Western Europe right now. And in some specialties, just because we are experienced and we are taking, especially our professors are taking their education in the US. And soon after, a new technology had appeared in the States, and our professors just carried to Turkey
directly
back
get
to
it.
just
Yes.
directly
Yeah.
starts in Turkey as well. And we just try to experience, we just try to apply to our patients by learning from our professors. And when, if we are talking about the patient numbers, just because we see much more patients when compared with the rest of the Europe, we just become over-experienced even when compared with the States.
Yes.
I personally experienced this.
Yeah.
Last year I was in States, and several years ago I was in the UK and in Switzerland as well. And this provides us to serve the best quality to our patients throughout the world, come from all around the world, with the much affordable prices. As I told, we are not claiming the cheapest price, but we are, especially if we are talking specifically in Istanbul, especially the hospital where I am working at, Hospital Derindere. Hospital Derindere is a relatively very big hospital when compared with the remaining hospitals around it, and it's very close to the main arteries, and it can be reached so closely, and we got so many advantages. I mean, we have a very high quality intensive care unit, ICU, both adult intensive care unit and newborn intensive care units, and they got their specific well separated isolation rooms as well for any, in case of any infectious disease spread, and this is very important.
So it's a really high quality health treatment you provide, especially in the hospital.
Yeah. Especially the hospital that I'm working at right now, it can reach to the best hospitals. It can be easily compared with the best hospitals with the remaining parts of the Europe, especially if we are talking about Switzerland. Maybe Switzerland is a very best quality country. If we are comparing, the CT scans may be better than the ones in Switzerland. In the MRIs, it's 1.5 Tesla, and it can be diagnosed any illness, any disease can be easily seen in such kind of magnetic resonance.
Okay. So, Dr. Mustafa, we talked about the high technology that Turkey actually gives its patients, especially in health tourism. I want to ask a question: is non-surgical procedure possible in nose aesthetics?
Nose job, we call that liquid nose job. Is a liquid nose job is injection of fillers, mostly hyaluronic acid in the nose. It has its own products from some brands. I don't want to give a name, but it has injectable forms, and you can inject under the skin of the nose to reshape, to give it a.
So this is actually possible.
This is possible. It is possible to not operate, but change the shape of the nose by with the help of fillers, and it has its own advantages and disadvantages. Its advantages are, it's quite easy. You can have a liquid nose job in 15 minutes by office standards, and it's healing like 1 or 2 days.
It's a fast procedure.
Yeah, it's a fast procedure, and it's available in most of the beauty offices, and it can give you sometimes close results to
what
proper
actually
nose job, but in my opinion, it has its own disadvantages. If you compare to the surgical nose job, it has to be repeated over time, because the product which is injected is absorbed in the body, in the skin of the nose. So you can have it done over and over again in time, like
Mhm.
1 year or 2 years. So,
So it can be
yeah,
repeated.
yeah, it can be. It has to be repeated. It needs to be repeated in time. You cannot have it all your life. It doesn't last forever. And um, the shape, the reshaping of the nose with fillers, in my opinion, is not does not compare to a well done surgical nose
procedure,
job,
yeah.
surgical procedure. But some patients do not want to take the risk of an operation, which is very low, I think, in my opinion. And some people have some some people are scared of being operated, so they choose to have a liquid nose job. And it has its own dangers also. The liquids are should be injected just under the skin. They shouldn't be injected in the vessels in the skin. So the injector, the healthcare provider, the doctor should be aware of, should have a good knowledge of the vessels of the nose and all the face also. The arteries, especially the arteries of the face, are very important when when applying fillers. If the filler is injected in the arteries, you may have very disastrous results with those kinds of procedures. But it is one option, without a doubt. It is an option to a surgical nose job, and sometimes, and most of the times, you can have a nice result. With
So
nose job.
surgical, non-surgical. When is the right time to get a nose job?
Well, the right time. You mean season? You mean the right
I mean
time?
season, I mean age.
Yeah.
What are the right fundamentals that make actually a doctor decide, yes, I'm going to do a nose job on this patient or not?
Well, in my opinion, no kinds of nose job should be applied to a patient who is under the age of 18. Sometimes we can do surgical nose job in girls like 16, maybe 16 or more in girls, or 17 or more in boys. But I don't think I think no kinds of nose job should be done under those ages. And there is not an upper limit of age when talking about a nose job. You can have a nose job whenever you want after those ages. And there are some seasonal issues in nose job, which I think there is no. Some people think there are seasonal issues, but our patients ask me, is it the right time? Can I have it? Can I have a nose job in winter time or in summertime? And my answer is no. There is not an optional season for nose job. People are performing and people are having nose jobs all over the world. In every season, every types of weather, they are having nose jobs. You can have a nose job in Saudi Arabia, or you can have a nose job in Russia, Siberia. Doesn't matter.
Doesn't even matter. Yeah.
It's just a surgical procedure.
Yeah.
Doesn't have to do anything with the weather.
Okay, so we talked about the advantages, the technology advantages, the health treatment advantages. I want to know, in 5 or 10 years, where does Turkey see itself in health tourism right now?
To provide much more high quality medical care, medical service to the people all around the world. I do believe that we should increase our share in this field because people deserve high quality with the affordable prices. That is our motto. That is our goal, to provide much more quality, high quality medical procedures, surgical procedures, all kind of healthcare to the all over the world, to the people living all over the world. We have patients from the States, United States. We have patients from the UK. We have patients from all entire continental Europe. And we are able to do that. And we do believe that we can do much to the people for increasing their health level. And that is our main goal, to increase the health level of the people living all around the world, and to increase our share for helping much more people to provide them high quality health care.
So with general health tourism is another issue, but what would you suggest to patients coming from other countries, from foreign countries, before they come to Turkey and get a nose surgery or a nose job or a nose procedure? There are a lot of names, I know. What would you suggest them be?
Well, I suggest first I want them to know, I suggest them to think about what they want with their nose. The shape is important. They are expecting a change in the shape of their nose. So what kind of change do they need? They need to ask themselves. And they need to think about if they have a breathing problem, because these are important things for me. For at least I'm talking for myself. I am very how do I say that? I give very much attention to these types of problems, and some pre-operative laboratory tests or pre-operative how do I görüntüleme imaging, some pre-operative imaging studies and some pre-operative blood tests.
So a lot of details should be actually.
We are performing them when they come, but if they have a chronic disease, we need to know, and we need to have the history of the disease. So they need to bring them their history. If they have any tests, if they have any procedures done before, we need to know the history of the patients, especially if there's a nose job before. Sometimes some patients come for revision nose jobs, so we need to have information about the historic history.
Yes.
And sometimes they need to they may have problems with the hotels or the transport, and if they ask us, we can provide those types of services.
Patients.
I would like to ask, especially for Derindere Hospital, what are the actually special treatments that you give to the patients coming from other countries?
Especially plastic surgeries and general surgeries, gallbladder surgeries, all kind of stomach surgeries, gastric sleeve surgeries, gastric balloon procedures, and all kinds of rhinoplasties, because otolaryngologist is with us. Almost all of the surgeries, except the cardiovascular surgeries, has been done in our hospital. And Hospital Derindere provides pre-operative and after post-operative care, proper care for all kinds of surgical procedures. I mean, and we are adding. On behalf of my hospital, I gotta add something just because I didn't add a little while ago. A couple of minutes before you asked me a question, and I should have added this thing because we are providing all-in-one service. I mean, when they reach to Istanbul, once they come to Istanbul, we are providing shuttle service to them.
Oh, you are.
And because our hospital is just so near to the new Istanbul airport, they can easily come to our hospital in just maybe maximum 30 minutes of time. And soon after reaching out to our hospital, we are relocating them to a very 5-star hotel. They can stay in the following days, just before the surgical procedure and after that. We are providing full support for their staying, and we are providing accommodation and all kinds of help. I mean, they can reach to their doctors. I'm not talking about one doctor, doctors, just like me and the other remaining doctors, and the remaining nurses and the other staff.
So there's a whole team actually.
Yeah.
Patients.
And we are providing even psychological backup. I mean, if they need, of course. I mean, we got, as I told, we have an expert clinical even an expert clinical psychologist in our facility, healthcare facility. Yes, psychological support.
I would like to ask, how do you actually follow the patients after the surgical procedure?
My surgeries?
Yes.
Well, after a nose job, I see the patient just after the operation. When I never get out of the hospital without seeing my patient when he's awake. I have to wait until he's awake, and I need to talk to him. I ask him if he's all right, any pain, any need, and I get out of the hospital after that.
Small details, but important
small
details.
Yeah. That's that's the type of obsession, I guess, with me. And I see the patient next day, and most of the patients don't need to stay more than one day in the hospital. So one night stay in the hospital. After the day after, I release the patients, and we apply. Sometimes we apply nasal silicones, tampons, and we put a cast on the nose. And after 1 week, after the surgery, we remove the silicones inside and the cast outside of the nose, and then we tape the nose.
Okay.
1 more week with the tape. The patient can go back to his own country after 1 week when I remove the tampons and the cast.
Just 1 week?
Yeah, just 1 week after the surgery, he can return to his country. Sometimes they need faster departure. They need faster departure. So I can remove the silicones
This
and
is
tampons.
possible, so,
Yeah, that's possible. Just maybe 4 days, 5 days, that's possible. And if it's a foreigner patient, I can also do the controls. I can do the interventions with especially aesthetic interventions, examinations on WhatsApp photographs, or just phone call with
FaceTime.
video call, FaceTime. I can talk to my patients. We are managing those
Afterwards, procedures. You may
procedures.
call it. Yes. Because I think it's a very important feeling for me. I think myself as a patient, all the questions that I actually asked, I'm addressed as a patient to you, because I think our viewers are really interested to know about the health treatment right here in Turkey, because I'm sure that they don't have an actual, quite large-scaled idea of what actually happens in here, what the technology advantages are, and this is why I'm asking the questions. And I think as a patient, I would really want my doctor to actually really be interested in me after even a year, because I know that nose procedures can go really badly after the surgical procedure, and that may be a nightmare for the patients. So for me, it's really important. I would like to thank you for answering my questions. This has been a really informative interview. I would like to thank Dr. Oğuzhan and Dr. Mustafa. They were kind enough to accept and come here and have a chat with us. And this is it for tonight in A Healthy Life. And we will see you next week. Good night.